Namaste. Welcome to Youth TV Show. In today's episode, we are featuring Leadership Academy's Career Counseling Center. The topic for today's session is the future of technology and software engineering in health and social sector. The counselors for today's session are Ms. Lauren SPIGEL and Mr. Duncan Spencer from VaxTrac, USA. To moderate today's session, we have Ms. KASHMIRA. Ms. KASHMIRA is an intern at UNAIDS and is pursuing her Master's in Public Health and MBA in Johns Hopkins University, USA.
Today we'll be talking about two fields merging together, healthcare and technology. Healthcare and technology independently are very lucrative, exciting businesses to be in. They are the new place where emerging ideas and innovation are coming about. And when you merge them together is when you hit the gold mine. So today we'll be discussing technology and healthcare and how bringing those two fields together can make a real difference in people's lives in low-resource countries as well as advanced nations where this is the future of medicine. So I'd like to turn it over to Lauren.
VaxTrac is a global health organization. We build and implement a mobile vaccine registry system. We have health workers working in hard-to-reach areas that are logging in the information about the children that come into their clinics. They put in which children got which vaccines onto a tablet. And so the information that they record onto their tablet goes directly to the decision makers instantly. And so this is in comparison to paper records where it could take weeks or months to reach decision makers. So this is really important because the people in the central levels, the health officials, are relying on that information to get an idea of the coverage rates of different vaccines and to understand which stocks of vaccines to send out to which communities.
I help create our Android software that we put on tablets, also building websites to store the data and make the data presentable in intuitive ways. We hope that it can have the effect of reducing vial wastage. We can send SMS to the parents to remind their children when their next appointment is. This is both in urban and rural clinics. We're hoping that through technology we can reduce the amount of paper used in these settings. And we love working at the grassroots level with health workers and vaccinators.
Where did you find this niche and how did you come to it?
Before joining VaxTrac, I was living and working in Nicaragua. I was doing a program called Peace Corps. It's a volunteer service 2-year program. While I was there, I started a project called Chatsalu, which translates to text health. And so where I was living and working, we found that almost everyone had cell phones, but almost no one had access to internet. And sexual health is a very taboo issue. And so we found that texting has been a really useful tool to get people that information anonymously and in a way that won't have any social repercussions. So yeah, from there I got really interested in this field.
I never planned to be in this field, I guess. I went to school to learn software engineering. My family had a big influence on me on always sort of traveling and helping your community. And so I got my first job out of school, but then, I wanted to really have an impact on everyday lives. So I left the USA and lived in West Africa for 2 years and taught computer engineering. When I went back to the USA, I wanted to continue in the same vein, helping people, everyday people, and use my talents.
Duncan, engineering, especially in Asia, and I know especially in Nepal, is quite a popular area of study and a popular career choice for many of the youth that live here today. Can you talk us through a little bit about how the traditional engineering can be merged with this innovative field that both of you belong to, and how youth in Nepal can look forward to having an innovative career within that field?
Sometimes people think of engineering as boring or too much math. Engineering can be a creative field. I mean, people can bring their other talents into engineering as well, whether that's musical instruments or design, like drawing and painting. But the key to being a good engineer is just being persistent. You're not born with the innate knowledge. You don't have all the answers on day one or even your first job. Like that's when you're really going to get your experience. The education's important, but just know that continual learning. You're going to be teaching yourself. So don't be afraid to try new things and fail. Like I failed many, many times before I succeeded.
And Lauren, as somebody that works in the field of global health, how have you seen from your time in school, pursuing your Master's of Public Health, to working at VaxTrac in this field, in this intersection of healthcare and technology, how have you seen technology positively influence the work that we do in global health?
I got into global health because the issue of equity and social justice really drives me. And so we have all these medicines available and projects and programs, but still there are people all around the world that aren't able to access them. And so when I stumbled across this field of mHealth and using technology for health, it's a whole nother avenue to increase access to services and information. And so that for me is really powerful.
Can you guys give us some more examples just for our youth groups to better understand what mHealth in today's world looks like? What are some other types of platforms that employ mHealth as the primary source of disseminating information or bringing healthcare to people that don't have access to it?
So mHealth is a growing field. It's really new. I think it's only been around for maybe a decade. Currently, I think there are more cell phones on the planet than there are people. So when you think about that, it's just so many people have access to cell phones and it presents a huge opportunity. People are developing like hardware to put onto cameras onto cell phones, like a camera where you could take a picture of a sample of blood and diagnose malaria from a rural place. Wow. People are sending text messages to increase information about certain topics like sexual or reproductive health. People are using text messages to remind people of appointments or for complicated drug therapies like tuberculosis, where people have to take many drugs. They're sending text message reminders, like what we're doing with VaxTrac, getting data on a health registry that's electronic, which is great because people get data faster and it's more accurate and it's really reliable, especially with disasters that happen, the data is protected. So there are a lot of interesting things that people are doing with mHealth.
I read recently somewhere there are more cell phones in Dharavi, which is one of India's largest slums, than there are toothbrushes. So it is certainly the globalization era where technology is making the world smaller and bringing everyone together. You have a background in global health, you have a background in engineering, I will be having a background in business, and actually all three of us could be working on the same project in very different sectors, which is what's most exciting about something like mHealth or technology in the global health field. So can you speak a little bit about how you would encourage youth to kind of think outside of the box when it comes to picking a career choice, as both of you have done?
Don't be afraid to volunteer, to learn maybe things that aren't covered in your courses. And don't be afraid to make the wrong choice. Sometimes the best thing you learn from like an internship is that is the career you do not want. That's as valuable as learning about the career you do want. Also choose the people you want to work with. You have to spend a lot of time with your coworkers, and it's important that you get along, you can work together, and maybe you share values.
I know a lot of people that struggle with this idea of what do I do with my life? And I mean, really the question is what do I want to do right now? Because if you're pursuing what you're interested in, it can evolve into so many ways and you can never predict exactly where your path is going to lead. For instance, one of my close friends, she did engineering in undergrad. In grad school, she studied marine biology, and then she got into entrepreneurship. Now she's working at an incubator for marine biologists, and so her diverse interests have merged. So there are always possibilities. You don't have to stick with one career.
Have you both had mentors in your lives that have helped guide your career direction? And how important do you think in today's world is it to have a mentor that is, experienced and can help you find the direction that you may want to go in?
Mentors come in all shapes and sizes. Sometimes I think that my peers teach me the most, especially when I was in school. I went to Hopkins as well, and so my colleagues were already really accomplished, and it was great learning from them and working with them. And now that we're starting our careers, we all support each other and learn from each other continuously. I've been really lucky. I've had great advisors going through school, and I think every time you take on a new role, you're gaining new advisors.
I think that's a good point, yeah. Especially about your friends being mentors, because youth supporting youth is actually where the future is. The youth of today is the future of tomorrow. And so those are going to be the directors of companies. Those are the people that are leading innovative solutions to the world's greatest problems. So if you can support each other at this time and serve as each other's guides, then that's something that can lead to incredible solutions for the world's issues. Duncan, do you have any comments on that?
My family was my biggest influence. My aunt, she did work in disability rights, so she traveled the world to help, I think, make better laws that protected people with disabilities and find them jobs. My dad, he started a food bank and a credit union. So I mean, I was always very aware of like what effect they were having on the communities around them. That has helped me, get to this stage.
Thank you so much, Duncan and Lauren, for discussing healthcare and technology with us today. I'd like to now open it up to the floor. We have students from higher secondary school as well as college, and please ask us whatever questions you'd like.
The success of health policies is entirely dependent upon its effective implementation. How can we use technology to monitor the impacts that our health policies and projects have had on the lives of people, particularly in the rural areas?
There are a lot of methods for evaluating a technology project, and actually more and more studies are coming out with the most effective ways, because health technology projects are new. And so the methods that you use for monitoring and evaluating a regular health project, it's not necessarily the same methods you'll use for a technology project. One example, for instance, is if you have a project that's already sending out text messages, one way to reach a lot of people is to send out short surveys through the text messaging instead of paper-based surveys. A lot of the methods that we use are qualitative as well, like focus groups and interviews. A lot of Duncan can probably talk more about this, but especially when you're using technology, a lot of the data that's coming in is shown on the back end of it. And so there's a lot of analysis you can do just from people using and interacting with your technology.
You might not realize all the things going on behind the scenes, like maybe how long it takes someone to complete a task is automatically recorded. There's no biased observer. The technology gives you the ground truth, so you can trust that information a little more. But yeah, the amount of data you get with a technology project is probably one of the biggest benefits.
To touch on your point about policy, I think another big area where technology is very well used in the work that I do is disseminating information about policies and the right people have, the legal rights people have to health. So we've used in my offices at UNAIDS, we use internet technology, as well as we send out little small podcasts of educating people that live in rural areas that don't have access to information, bringing the information to them so that they're aware of their rights and what they're able to access.
So talking about technology, it is a grooming sector worldwide, whereas talking about social sector, people quote it as it's only for name but not for fame. Likewise, technology is quoted as the sector where we can earn money. So in a developing nation like Nepal, how do you think these two sectors can go in a parallel way?
There's a lot going on. For instance, projects come in and they're using technology, and then countries suddenly realize that they don't have the policies in place to monitor it, or they realize that they need to link everyone together so that everyone can work together. So something that's happening in Nepal is that they have an e-health working group and they're trying to figure out exactly what role technology plays in the health field. There's a growing community of people who are working on health technology projects, and a theme is integration. How do we all work together to achieve the same goals and to work towards health system strengthening? So a lot of the things are like working on similar platforms and forming partnerships.
Doing social work or working within on a grassroots level doesn't make money, so to speak. I think that idea is slowly becoming more and more outdated, actually. We live in a very global world where global health is a huge priority for everyone living around the world, whether it be in a country like Nepal or where we're from, the United States. Global health is on a top priority, and so and if it's a top priority, there's a lot of money in global health as well. The other thing I would like you guys to consider is social entrepreneurship. I think global health has slowly stopped being associated directly with NGOs or places that traditionally don't have a lot of funding, and therefore we get this rep that there's no money in global health. Social entrepreneurship is this incredible mix of the two, you know, using a business methodology to apply to social issues in the world, where you don't have to feel guilty about making money because you're making a big difference as well at the same time.
In a developing country like Nepal, where most of the people in rural areas do not have access to technology, what would you like to do to make them their health and their condition?
Starting from the assumption that rural means that something is not working as well, I mean, maybe there's nothing wrong with their vaccination program or another health. I mean, if it's just the technology, I mean, we can give the right training and support, create the right infrastructure to help them learn and progress. Like, I mean, we need to invest in those systems.
The global penetration rate of cell phones, like I was saying, is very high. There are more cell phones than people, and so I think you'd be surprised. You may feel like you're in the middle of nowhere sometimes in these very rural environments, and you'll still have cell phone service. Even if they don't have electricity in their homes, there's a place around town where everyone will go and charge it. And so I think it's oftentimes surprising how accessible the technology is.
There are pockets of Nepal where people don't have cell phones or people don't have access to technology. But because this is slowly disseminating, or I should say quickly disseminating, it's a perfect opportunity for youth to kind of jump on the ship early on and find ways of bringing that technology, bridging those gaps to people that don't have access to it today but may in 5-10 years.
Is there a good career in social sector or only work people do for self-satisfaction?
I come from a consulting background, so very business oriented, I worked with hospitals doing process improvement to improve patient outcomes. Now I work in HIV, on the ground, in the field, so to speak. And I would say I gained personal satisfaction out of both of those jobs. And I think both of those jobs have given me skills that if I had just picked one or the other, I wouldn't have gotten. I'm really interested in merging business methodologies within the field of public health, which can oftentimes be bureaucratic and slow and not moving as fast as it could be moving. Global health work or social work is just self-fulfilling, and it doesn't bring any economic benefits to your life, which is not true. The other great thing about working in social work, especially if you work in global health, is you get to travel the world, which these folks are doing, for example. I think that's one of the best ways of gaining skills that you wouldn't get working within one specific narrow field.
Well, we know that technology and health are two distinct fields. So what are the challenges of merging these two distinct fields in one?
There are a lot of challenges. One challenge is changing the status quo. So, for instance, the work we do with VaxTrac is going from paper records to electronic records. And so there's often a big challenge at overhauling an entire system. There's a system in place already that uses paper, and we're working towards making it digital, and it's a huge undertaking. So that's a big challenge. Another challenge is setting up all the infrastructure that you need for a technology project. But like the cell phone network that you need, the servers that you need, all of that infrastructure takes time, and people need to invest in it.
The technology sector is comfortable with change, right? New products that maybe go directly to consumers or work around the current system, whereas health is a very institutional field, usually associated with the government and very well regulated.
Can you speak a little bit to that? How do you see technology as an evolving science, especially in relation to healthcare?
Yeah, it's always evolving. Duncan loves to say that we always ask him, when is it going to be finished? When are you going to be done with the software? And he always says, it's never finished. Because it's constantly evolving and you're constantly getting feedback from people and iterating. And that's how new ideas come about. And that's how you make all these great innovations, is from the idea that it's never finished. You're always open to new possibilities.
And I think sometimes we think of innovation as we only see the end result, like this was one big leap. And really, you forget like all the small things that had to happen in order for that to be possible. And sometimes it's not a technical person who puts the pieces together. Sometimes it takes someone from a business background, or it takes someone from a very different background to see the bigger picture. So even if you don't want to strictly major in engineering, it's important that you are tech literate today. And young people have a great advantage because maybe our parents didn't grow up with technology. So you have a head start in this field.
There are many supporters of bringing this kind of technology into low-resource countries, as it's obviously opening up a world to people that they haven't been exposed to before. But there are also people that say technology is ruining the world and it's making everyone more isolated somehow, and we're losing the human connection, keeping the humans in the middle of everything that we do. So can you speak a little bit about how human-centered designs within the field of mHealth and global health and technology, how do you guys keep the customer in mind, the human in mind?
You have to have a respect for them. You just have to keep an open mind that just because we're more exposed to advanced technology, that doesn't make us the experts. We rely on the advice of normal people. I mean, they know their job better than we do. We have to listen. We need to design things, not always in the way we think.
As much as you study and as much as you're in this field, you're not the expert. If you build a technology for someone and they're not using it or they don't get it, it's because you failed. It's because you didn't listen hard enough. It's not the person's fault. The person that you're designing for, the community that you're designing for, they are the experts. And so it's really important to keep that in mind. So in fact, I think technology is a very social thing, especially when you're using it for social causes.
Thank you guys for all of your questions. You're all obviously thinking along the right direction, and I know it was really helpful to have Lauren and Duncan here to kind of guide you in ways that you may not have exposure to. Thank you, Duncan and Lauren, for discussing this very innovative field, and I hope to see many of you as a result of this, approaching this field with open arms and opening your minds to the possibilities that rest outside of the traditional career fields.
If you are a high school or a college graduate, you can also visit our Leadership Academy's Career Counseling Center for guidance and counseling on further education. For registration, call us at 01-4257-250. Our mobile number is 986-11-55900. You can also visit us at facebook.com/leadershipacademyktm. We will be back next week with a new episode on Youth TV Show. Namaste.